Thank you, Ange. Well, having a lonely heart has been linked to heart disease. In a recent study, Monash University found a link between social isolation and depression and cardiovascular disease. To tell us more, lead academic Dr. Rosanne Freak-Poli joins us now from Melbourne. Thank you so much for joining us, Doctor. Talk us through your findings.
Hi. We followed 11,500 older, healthy Australians. They were aged 70 years or more, and they were healthy because they had never had a cardiovascular disease event before. They didn't have dementia, and they didn't have any physical disability or anything limiting their survival in the next 5 years. What we found was that these older Australians that reported that they had low social support had double or 200% greater likelihood of having a cardiovascular disease event over the 4.5 years that we followed them. If they were socially isolated, they had a 66 greater increased risk of cardiovascular disease in that 5 years. So what we really interestingly found was that in this healthy older sample, social support and social isolation were more strongly related with cardiovascular disease risk than loneliness.
Wow, yeah, the cardiovascular disease, I mean, it's the leading cause of disease and death worldwide. How can we reduce the health and economic burden of that?
So social health does carry a huge burden, first of all, to employees, as it's been linked to absenteeism and days off for caring, as well as higher staff turnover. But it's also been linked to greater healthcare use, because people who have poor social health are looking for social interaction and social stimulation, so they sometimes access the healthcare system more often to achieve that. So if we I'll explain the terms social isolation and social support, because really it's about the number of times we see people, so that's social isolation, but getting out in the community and connecting with people and seeing people. And then there's social support, which is actually around the number of people that we can confide in and or ask for help. So in my study, what I was looking at is a very low categories. We looked at whether someone had 4 or more friends that they could call on for help or are confined in. So if you have 2 people that can do both, then that would be enough for your cardiovascular disease risk.
Wow. So just to confirm, so you can understand the link between isolation and depression, yeah. But how does being socially isolated actually physically impact cardiovascular health? Do we have any understanding of what's actually causing the kind of physical manifestations of bad heart health?
I know that animals survive evolutionarily better if we are in herds. And with that, we know, for instance, that cattle that feed together, they protect their weakest. And just as an example, and humans, we're social creatures. So our body's response system goes into a sort of stress response if we're isolated or don't have support for long periods. So that will increase our it will decrease our immune response. So we have increased white blood cells, we have increased stress hormones, and these make our bodies or change our body's reactions to just normal everyday events for the worse.
Yeah, so make sure you reach out to elderly neighbours and friends and family members. Doctor, thank you so much for joining us this morning. Really appreciate it.
Thank you. And exactly, this is a great festive time. I'm wearing red today to signify heart health and to thank the Heart Foundation of Australia for co-funding my research.
Oh, good congratulations. Well, great work you're doing. And yeah, Christmas can be a really lonely time for a lot of people as well. So it's just reaching out.
It makes a big difference to people. Like, you know, all you have to do, it can start with just saying hello to someone you don't know. You don't realise what impact that has on people's lives.
Definitely,
you know?
Yeah.